Understanding the Vaccine Adverse Event Reporting System, also known as VAERS. Background. What is VAERS? VAERS was established in 1990 and is a national early warning system to detect possible safety problems in U.S. licensed vaccines. VAERS is mutually managed by the Centers for Disease Control and the Food and Drug Administration. VAERS is a passive reporting system, which means it relies heavily on individuals to send in reports of their experiences post-vaccination to the CDC and FDA. The primary objectives of VAERS are to detect new, unusual, or rare vaccine adverse events, monitor increases in known adverse events, identify potential patient risk factors for particular types of adverse events, assess the safety of newly licensed vaccines, determine and address possible reporting clusters. Examples include suspected localized, either temporally or geographically, or product, batch, or lot-specific adverse event reporting. Recognize persistent safe use problems and administration errors, and provide a national safety monitoring system that extends to the entire general population for response to public health emergencies. Facts about VAERS. VAERS is a national vaccine safety surveillance program that helps to detect unusual or unexpected reporting patterns of adverse events for vaccines. VAERS accepts reports from anyone, including patients, family members, healthcare providers, and vaccine manufacturers. VAERS is not designed to determine if a vaccine caused or contributed to an adverse event. A report to VAERS does not mean the vaccine caused the event. VAERS is a passive surveillance system, meaning it relies on people sending in reports of their experiences after vaccination. Healthcare providers and vaccine manufacturers are required by law to report certain events after vaccination. If VAERS detects a pattern of adverse events following vaccination, other vaccine safety monitoring systems conduct follow-up studies. What information will be needed in order to report? Patient information, such as age, date of birth, and sex. Vaccine information, such as brand name and dosage. Date, time, and location administered. Date and time when adverse events started. Symptoms and outcome of the adverse events. Medical tests and laboratory results, if applicable. And the physician's contact information, if applicable. How is the data used? VAERS scientists look for unusually high numbers of reports of an adverse event after a particular vaccine or a new pattern of adverse events. If scientists see either of these situations, focus studies and other systems are done to determine if the adverse event is or is not a side effect of the vaccine. Information from VAERS and vaccine safety studies is shared with the public. Throughout the process of monitoring, VAERS conducting studies, and sharing findings, appropriate actions are taken to protect the public's health. For example, if VAERS identifies a mild adverse event that is verified as a side effect in a focused study, this information is reviewed by the CDC, FDA, and vaccine policymakers. In this situation, the vaccine may continue to be recommended if the disease prevention benefits from vaccination outweigh the risks of a newly found side effect. Information about newly found side effects is added to the vaccine's package insert that lists safety information. Newly found side effects are also added to the Vaccine Information Statement, or VIS, for that vaccine. If serious side effects are found, and if the risks of the vaccine side effect outweigh the benefits, the recommendation to use the vaccine is withdrawn. Methods of reporting. Do your part for vaccine safety. Report to VAERS. Reporting adverse events to VAERS helps scientists at the CDC and FDA keep vaccines safe. There are two ways to submit a report to the Vaccine Adverse Event Reporting System, VAERS. The online VAERS report must be completed and submitted in the same session. It cannot be saved and edited at a later time. Note: sessions time out after 20 minutes of inactivity. No information is saved. Option 2. Download a writable PDF form and upload when ready. Provider information. Why reporting is essential. COVID vaccine. Healthcare providers are required to report to VAERS the following adverse events after a COVID-19 vaccination, under the Emergency Use Authorization. These events can always be modified by the CDC, so it's important to stay updated. vaccine administration errors, whether or not associated with an adverse event, serious adverse events regardless of causality. Serious adverse events, per the FDA, are defined as death, a life-threatening adverse event, inpatient hospitalization or prolongation of existing hospitalization, a persistent or significant incapacity or substantial disruption of the ability to conduct normal life functions, a congenital anomaly or birth defect, an important medical event that, based on appropriate medical judgment, may jeopardize the individual and may require medical or surgical intervention to prevent one of these outcomes. Cases of multi-system inflammatory syndrome, and cases of COVID-19 that result in hospitalization or death. Healthcare providers are encouraged to report to VAERS any additional clinically significant adverse event following vaccination, even if they are not sure if vaccination caused the event. Also report any additional select adverse effects and/or any revised safety reporting requirements per the FDA's conditions of authorized use of vaccines throughout the duration of any COVID-19 vaccine being authorized under an emergency use authorization. If you need further assistance, please email info@vaers.org or call 1-800-822-7967. If you have any questions, please reach out to Lori Saul at Quality Insights.